So we've got a few people there, and while we usually give people some time to join, I think we should probably just get started because we have lots to catch up on tonight. So first and foremost, thank you for joining us on our expert series. It's really amazing to have you, and just, you know, start off this year, it's February, but essentially start off our season with somebody who is a seasoned pro in women's health. So just to give a bit of background for everyone joining, Dr. Stephanie is trained as an obstetrician and gynecologist, and I'm going to let her explain a little bit about her background because it's very impressive. But needless to say, she has devoted her career to understanding more about women's health, and where we actually met was at a we both shared a panel talking about the future of femtech and women's health. And I think we actually, it's strangely, even though we met on a panel, we kind of hit it off immediately because we both had this instant kind of just click around the same issues when it comes to women's health, around the same frustrations when it comes to current practices, but also kind of shared a love for how to implement technology successfully in current practice, and how essential it is to start weaving in new technologies. So Stephanie, do you want to give us a little bit about your background without wanting to read your extensive CV?
I'll do a short summary. Thanks, Helen. Hi, everyone. My name is Stephanie. I'm an obstetrician and gynecologist by training. I worked within the NHS for 15 years. Also did women's health in a few hospitals outside of the UK, like in France and Brazil. And in 2018, I left the NHS because I was seeking what the future of women's health was. So I worked mainly as a general gynecologist at first, and then did a lot of work within women's cancers. So the health of the ovaries, uterus, fallopian tubes. And when I left the NHS, the main aim was to sort of use my experience and expertise to help people outside of hospitals trying to solve problems within the NHS. And whilst as doctors, we sort of do so much within the healthcare systems, looking after patients on a personal level, it's very difficult to sort of do that and at the same time look towards what is the future, how can it be better for women, what are the healthcare needs of women that we are not meeting, and how can we do this? And this is where industry and startups and companies like Fertility Health and others in the sphere, you know, from the company you buy your tampons from to the companies that you buy your ovulation sticks from or pregnancy tests, they all add to how we experience women's health. And so I left the NHS and started to work within policy and industry, advising companies on the future of health. It is what I do now. I'm a senior advisor to the World Health Organization in women's health and digital health. So specifically how technology can improve women's health. I also work with women's health startups, a range of which do things from simple period tracking to trying to find new ways for women to access help for gynecological disorders, and then of course with fertility companies. And really, I guess my main passion is the future of women's health. And yeah, that's mostly it.
Awesome. Well, we've got a lot to get through, and thank you to everyone who sent in some questions this evening. It's been amazing hearing some people's insights from just to put a bit of context for anyone who's just joining and doesn't know anything about Fertility. We are an at-home hormone and fertility testing company, but we are driving a revolution that is around proactive fertility testing and proactive engagement with your reproductive health. So while it may seem like we are a test, we are much more than that, and our questions are very centered around being a triage to extrapolate any information about your health or your symptoms or your cycles that could indicate a reduced fertility. So we're very much around the research that is involved in trying to glean more insights into women's health generally and all of the common conditions So we started with a very simple idea, which was, why can't I figure out what my fertility is at without going down as an extensive route like egg freezing, and have ended up with quite a comprehensive solution, which we hope will help many people. And people initially said to us, the only people who will be interested in this test are those who are actively trying to conceive. And actually those people clearly did women a disservice, because the majority of people who come to us are those who are either planning for the future. We're a generation of planners, and why wouldn't we be? And those who are just curious about their reproductive health. So I think that really gives us insights into the innate curiosity that we as women have when it comes to checking in on our fertility. And I think a lot of that stems from a lifetime of misunderstanding when it comes to our symptoms and our periods, and what is actually going on down there and in here and up here as well. So we'll start, I think, a little bit around fertility planning options. I think the most topical area that people like to talk about when it comes to fertility planning is egg freezing. And I just want to, we've got plenty to cover on this, but Stephanie, do you want to give us an overview of egg freezing as a technology itself, as opposed to egg freezing as an ideology?
Okay, so egg freezing is a process by which you essentially preserve your fertility. And the basis for egg freezing is that we know, and the science tells us, and the physiology tells us, and every proxy for really looking at what happens to the quality of our eggs as we age, tells us that as we age and we go towards our 40s, whilst the number of eggs you have reduces, the quality of the eggs that you have reduces. And this is really important because, and I'll come to my personal story later on, and what proactive fertility means to me personally, not as a gynecologist, but as a woman. And essentially, the idea with egg freezing is, and the way I like to describe it is a way to become your own egg donor if you do need young, healthy eggs in the future, should you either find yourself not able to conceive for various reasons, or you find yourself coming to that later age, in the late 30s, early 40s, where you don't have a partner. And I will come and touch on it, but if you look at all the studies internationally in countries that have been that have more women freezing their eggs than in the UK, you'll find that actually the reason for women freezing their eggs isn't this notion that they want to delay childbearing and they want to have careers, but it's actually that a lot of women don't find partners.
Absolutely.
And are single. And in fact, the two people I know that have recently frozen their eggs, friends, and this is honest, one of them was in a relationship for 8 years and got divorced at 33. And the other one was in a relationship for 10 years and got separated from a partner at 40. And so again, having a partner at a certain age doesn't necessarily mean that you will be able to conceive naturally either by yourself or, or you will have a partner to conceive with. So egg freezing, essentially, it's preserving your fertility, storing eggs, and recently we have come to find that the methods, the technology behind egg freezing has improved significantly, which is why it's very difficult to really understand the data and the success rates around egg freezing, because it's still relatively new as a technology. And this new process of freezing the eggs is called vitrification, where you're essentially flash freezing eggs from 37 degrees to -196 really quickly in under a second, in order to avoid ice crystals. So I like to think of it like ice cream. Sometimes you freeze ice cream and it's still nice and creamy, and other times you've got this annoying icicles on the top. And it's something like that, this new technology. And we are seeing the data for this new technology that the eggs that we freeze are increasingly becoming turning into live babies. So again, people say, how good is egg freezing? And it's not about when you unfreeze or you thaw the eggs or defrost the eggs, however way you want to think about it, how, if they're still alive, if they're still viable, but also really whether those viable eggs that have been thawed, gone from frozen to being defrosted, lead to a successful pregnancy. And so traditionally, if we look at the history of egg freezing, it really started around women, just like with, storing sperm, women who had medical problems. So you were diagnosed with cancer at the age of 35. That's when the technology started to be used for people who had medical indications to freeze their eggs. And then the regulators saw that the technology was actually working, although the success rates weren't brilliant then, but it was leading to some live babies from eggs from these women when they went back to use them. And so what you'll find now that we are the sort of new preventative health trend for women to freeze their eggs, which of course started in the States, has been accelerated by Silicon Valley and the startups, where companies like Google and Apple are offering women payment plans to freeze their eggs. We're finding that we're seeing more and more data, and actually the data is improving for egg freezing as far as what happens when you go back to use the eggs and they defrost them, whether it can actually lead to a live birth. So egg freezing is that whole process, but the process of egg freezing in itself, I like to split into sort of 5 phases, because very simply, because a lot of people don't understand when you think about egg freezing, you read things up, that there are steps to egg freezing. And for me, what's really interesting and relevant to what Helen does is this idea that the first step of egg freezing is actually diagnostic. It's a way of screening women to actually select where they're at. Yeah, to select the right people for egg freezing, to make sure that there are no issues that might either lead to increased risk or indeed that the process will be successful. So when you do the full hormone testing, you're also looking at trying to predict how to give drugs to induce eggs and whether or not the process will work. And that process in itself is the same process that you would continue to do if you were monitoring your fertility proactively. And I say that because as a gynecologist, when I was in my mid-30s, it was relatively new in the UK. We didn't have a lot of data with regard to egg freezing. And the only people I did know who were freezing eggs were women who'd been diagnosed with cancer, or their husbands had been diagnosed with cancer, or there were issues. And at the time, we didn't have that sort of what we have now, especially post-pandemic, which is this sort of women's empowerment and this idea that we don't have to wait for healthcare professionals to tell us what to do and how much we need to know about our health, that we could go and find things out. And certainly you didn't want to wait until there was a problem. And this is what wellness is. This is why you do yoga. This is, why we look after ourselves. It's how can I be proactive so that I don't, if there is a problem with me down the line, I pick it up early. And so this first step of egg freezing, which I call the sort of diagnostic screening monitoring phase, is something that I started to think about when I was around 36. And I certainly was someone who was very career driven. I was a surgeon and I was a gynecologist, but I didn't necessarily, and I'm not a fertility specialist by practice, but I'm a cancer specialist. So I probably dealt with women who are freezing eggs for way longer than a lot of fertility doctors, because I saw it, I've seen those women, since 2012. But essentially that for me, what a lot of that stuff triggered, even though I have to admit, in 2017, 2016, I myself didn't really understand the data for egg freezing, understand the information you really need to process to make decisions. What I did realize when the conversation started around egg freezing then, where wellness and proactive planning wasn't a thing, was that I wanted a way to monitor my fertility. And in retrospect, when I look back, I'm lucky that I didn't have any problems. But if I know now, if I knew then what I know now, this sort of proactive monitoring that I did at 37, I would have started at 27.
Yeah.
Because I don't know if I would have had problems. And I have friends my age who have had problems.
I think we all have friends who have lots of problems.
Exactly. And so that for me is that this talking about egg freezing is also talking about preventative health in women's health, is talking about proactiveness. And that first step is really important. And the way I did it in that time was I as a gynecologist, I knew what tests to do. So I would sort of find a way to get my GP to do them, even though you can never go into your GP in the UK and say, can I have this test because I just want to know how I am and do
You just
my
won't do it unless you're actively trying and failing to conceive for over a year, which is counterintuitive.
Or you're a doctor and you know what to say, or you like make things true. Sometimes I say to my friends, now that we have platforms like Fertility, you can say, just there's this company called Fertility, go and do a test. But I would say to my friend, when we're all 36, and they would say, how come you're getting these tests? I'm like, okay, go to your GP and say this, and
I've told people to go to your GP and lie. Before we had Fertility, it's part of why we started Fertility, was the frustration with having to either send somebody to, when somebody came to me looking for help, saying, okay, you actually don't fit criteria, and they're not going to pay attention, and they're definitely not going to listen to you or test you. If somebody was single, again, a lot of the time when people want to check in on their fertility, it's because it's precipitated by a breakup. It's this oh shit moment of, okay, that safety barrier I had around me that I could, if I wanted, have a baby with this person is now gone. And telling them you have to go to the GP and lie, tell them you've been trying for over a year. And like, but I'm single. I'm like, just make it up. The only way they're going to test you anything by proxy, and they still won't test your ovarian reserve marker, is to lie, or if something is actually wrong, which is a really messed up way when we think of the prevalence of infertility in our society, which is 1 in 7 in some places, 1 in 6 in other places. This is a huge number of people who are suffering from infertility, and a huge number of more people who are going to suffer from infertility, but don't yet realize it. So to me, preventative fertility planning isn't actually, I don't really think it does fall within the wellness, because wellness is kind of like, this would be nice to make my life feel better. This is essential when it comes to looking at the current statistics around women's health and fertility generally. I think this is something that we just haven't gotten into our mindset yet across the general population, that this is actually essential health monitoring, not just, I guess, trivial or choice-based fertility monitoring.
Yeah, I mean, I think that there was a recent study in America actually that showed that 33% of doctors had some form of subfertility or problems trying to conceive by the time they even got to 35. And this is a group of women who don't necessarily do the proactive. I think, a lot of people ask questions, well, you're a gynecologist, well, I think that the presumption that when it comes to your own personal health, that the tools are there for you to really think about it, is widespread, because people think, well, that's what you do for a living, you know exactly what to do with your health. But I think that, again, the way we look after patients in our healthcare systems is our general guide for how we think, what we think is okay.
Yeah.
We don't always extend beyond that for ourselves. My personal reasoning for going to do that, the screening, at least from 36, is realizing.
So you tested every year from 36?
From 36, because at that point I'd started to hear I started to hear things, and actually mostly from sort of general media and around, God, up to 15% or more of us will be infertile. Women who had careers and who were single in their late 30s were more likely to need IVF. The older you get, your egg quality decreases, and so I wanted to know, and at that point I'd had friends who'd had problems trying to conceive, or I wanted to know. I thought it was important, so started doing these tests. And so the whole egg freezing process, and again, for me, it stopped there. One, because I was 30, in my late 30s, I really felt from the information I had there, I'd missed the boat, that if I was going to freeze my eggs, I'd do it 35 or younger. And then the other thing to say was, at that point, I also understood that just doing those tests just for 1 year wasn't enough, because I knew that I had to keep doing them regularly every year. And I felt that I understood what those tests meant and what they didn't mean enough to know when to act, when I saw my fertility, because everyone's slightly different. And, the general presumptions.
Everyone's very different, actually.
Well,
We see 28-year-olds who have primary ovarian insufficiency and are going into early menopause. We see a lot of disparity around the generalized statistics when it comes to the population. And essentially, what I've come to realize is that statistics are very harmful. We can either use them to our advantage by saying 1 in 100 is probably not going to be me, or we can use them to our disadvantage by we will always assume that we are going to be the lucky ones. But equally, they can be fear-mongering when actually people's fertility range significantly for different ages. And so we can have too much faith in a statistic saying, actually, most people my age would have this fertility, and actually we just can't rely on statistics. And I think one of my major disillusionment with scientific and clinical research at the moment is just looking back and saying, but what were the numbers of people that they used for this study, and how reliable is this study in telling us success versus failure versus outcomes? And actually the data is very, very unhelpful, and it's quite shocking really to see the low numbers of people where they haven't appropriately said, actually, the people of this age versus this age versus this age. Everyone seems to wave a magic wand and say over 35 things start to go downhill, when the reality is actually, I think 86% of your egg reserve is gone by 30, and 30 is the new 20 now, 40 is the new 30. Everybody is acting and behaving a decade younger than they would have. We can no longer live by the same parallels as our parents did. They had all had us in their probably mid-20s. And so the kind of idea that we're not yet grown up enough to do something has really become pervasive in our society, where 30 is actually considered quite young. But as you know, there are very unhelpful terms around geriatric mothers, and actually, as much as we criticize from a societal standpoint the use of geriatric mothers when it comes to mums over 35, they came about because of the medical complications that exist and persist for older mums, not just during pregnancy, for them creating complications for the pregnant woman, but equally gestationally for the growing fetus, and the double-fold effect of increased complications when it comes to just growing of the baby, the health of the baby, health of the mum, and delivery are all things that actually led to this idea of a geriatric mother, and why extra care is needed for women above a certain age, which is not nice. And people do fight back against that term. But I think very often it's important to, rather than just jumping on the bandwagon and complaining about it, understanding the reason why a term came about in the first place, and maybe not getting angry, but taking action.
Exactly. And I think also that, whatever we do, women will have babies later. We're living longer.
Yeah.
Our society has changed. The role of women in society has changed. I think the term geriatric mother is going to be a thing of the past. In 10, 20 years, it will be fairly normal to have a child at 40 or 42. But in the same token, whilst we know that most women who have children later at 40, 42 don't do that, I don't think by intention. I think I always knew I'd have a child late in life, given the career path I chose, which was surgery and cancer surgery. But I certainly didn't think that it would be difficult for many reasons. One, that it would take me so long to find a partner, and two, that when I did try, even though I'd been tracking my fertility, that it wasn't going to be as easy as I thought. Because again, and we'll come to talk about egg quality, I felt that I had lots of eggs, but then I wasn't quite, there was no way of knowing specifically what the quality of those eggs are, even though obviously the more eggs you have, the more likely 1 out of 10 is going to be a good egg. But that,
even that figure, 1 out of 10. So very often when people talk about, you know, your ovarian reserve or your fertility as you know, and taking, well, what we measure is AMH, which is anti-Müllerian hormone, which is basically a hormone that is secreted by each of the developing potential eggs within your ovary. And so it stands to reason that the higher amount of AMH you have, the higher number of these potential eggs you have. But as you mentioned, that's only one element. And that this is why, as part of the fertility journey, we take into account over 54,000 variables so that we don't just take AMH into account. But that, yes, it is actually a very good, relative, reliable marker for somebody's fertility. But when we look at it in comparison to, let's say, egg freezing, I think there's an assumption that egg freezing, again, wave a magic wand and we're going to get as many eggs as we need. And that from that, we can just freeze them and have them later. And like you said, 1 in 10 is probably going to be of suitable quality. And that's actually quite a significant number to think about. When you think of the average number of eggs that would be received from any single round of egg freezing, what would you say it is?
The average number of eggs that will be received, well, it depends on your age, a retrieval.
Yeah.
So, you know, when you, and this is, I say, the catch-22 of egg freezing. And I'll just, for our listeners, I talked about the first step of egg freezing, which is just the monitoring, checking where your baseline.
Yeah.
The next stage is how you prepare to get the eggs. So you give hormones. So your natural cycle, every month you release something called FSH. You get about 2 follicles that start to grow and mature. And then something called LH, mid-cycle, triggers one of those to be released as the egg, with preparing you to collect eggs to freeze. You're essentially giving hormones so that you get more than just 1 or 2 follicles that are growing. So you have as many as possible to be able to retrieve. You need them at a certain stage of maturity. And then you give something called a trigger shot that is supposed to mimic your natural, the hormone that peaks, that causes ovulation. And then 36 hours later, you hope to retrieve as many eggs as possible. The current data is that you want to get about 15 eggs. And if you think about it, and if you think about what happens after you freeze eggs, the reason you want to get about 50 eggs is freezing eggs, taking an egg and freezing it, to having a live baby, holding a baby, has many steps. So the next step is then when you take out the egg, then you freeze it, then you thaw it. So those are the 5 steps of egg freezing. But the steps to get a baby then go on. So when you're ready to use those eggs, and I'll come back to why I'm explaining all this, when you're ready to use those eggs, there are about another 7 steps that determine whether you get an egg that turns into a baby. And that is how well it thaws. So when you defrost it, how many are still viable alive? So at that point, you say you got 15 eggs, which is a good number in general.
1 5 for anyone.
1 5. Eggs. Okay. So, and actually, to be honest, women who are freezing now in their late 30s don't get 15 eggs. No. They get 15 eggs when they have
3 rounds,
multiple rounds of egg freezing. So think about what that is to go through as far as stimulation, and then think about the cost of that.
It's like having your period on steroids, period times 10, because of the amount of hormones that you need in order to mimic 10 times the number of eggs that month, or 15 times the number.
So actually, one of the reasons I decided 37, even though things weren't so not to freeze my eggs, was I felt that I missed the boat, because I, as a clinician, the way I balance risks is very different. And so for me, I felt like the time to freeze my eggs would have been at 30 or 29, if I so chose to do it, because from my monitoring at 36, I was like, okay, I'm okay. So even if, you know, I'm me, but so my risk, if things look good at 37, then the likelihood is that at 28, that they were fine. So I may never have been a candidate for egg freezing. And egg freezing isn't for everyone, but for the people that it is full and it is useful. And now I know 5 babies, friends that came from frozen eggs. For the people that it is for, it is better early than never.
Yeah.
And that reason is that to get a successful baby from a frozen egg, the egg has to be thawed, defrosted, and be viable. So 80, so you lose a few. We come down to say about 11 eggs, because 80 to 90% currently survive. Of course, it depends on the clinic, it depends on their processes, it depends on
the embryologist.
It depends on the embryologist.
More than anyone.
The storage technology, the safety of storage, so many things that are important to ask when you are getting this information from doctors. You know, how many of your eggs survive when you defrost? When women are ready to use their eggs, how many of your eggs survive even before you've done anything with them? Those are the kind of questions women need to be asking, each clinic, for example. But anyway, so the process is then you want to culture the embryos, you lose some more.
Well, you got to fertilize them first and make sure that the sperm.
You get successful fertilization. You lose some more. Then you culture the embryos. You lose some. Then you want the embryos to develop, and so the ones that get to the stage that you need them, so blastocyst stage and viable. Then you have to check their chromosomes, there are no genetic problems with the embryos. Then you have to transfer the embryo into the uterus and make sure that it sticks. Then you have to have a healthy pregnancy. So to get from that 15 eggs to a live baby, you're usually getting 1. So it's 15, and all those steps, you lose eggs until there is 1 that leads to a baby. Recently, I had a friend who froze her eggs at 34. She needed 2 cycles, and she got 4 in one, and then 5 in the next. Eggs. So 9 and 2 cycles, and she's 34. Now, everyone's different. The data shows that at 30, you should get an average of 15 eggs. At 34, you should get certainly about 10 eggs for each cycle. And as you get older, the number of eggs you get for each cycle goes down. But everybody is different. Yeah. I may well at 36, given my stats or my personalized score, which I didn't have a fancy algorithm like Fertility, but I just kind of trying to make it up myself from doing my test. I convinced myself that my score would have been pretty high. From looking at my friends who were younger, I thought, you know, I'm sure that my chances of having
I like to do that about age.
Good quality. It's true that
I think I have less wrinkles.
Exactly. Just
the delusion stats.
The delusion, just looking at my friend who's 5 years younger than me and has more wrinkles, I think that I'm going to have more eggs and better quality eggs. We know that that's not the case, but
also weirdly though, we joke about, you know, your physical appearance and your age. This actually does have a big contributor to your egg quality and your egg and your ovarian health. Like our life, people think that when you look inside your body, you think of your body as being, of all of your organs as being these islands that are untouched by every other process, every other thing they're exposed to. Like our digestive system is only there for dealing with food, but actually we know that our food affects our weight, our heart, our liver, and when it comes to our exposures, like the things that we intake in our lifestyle, like exercise, we know that exercise has an effect on our reproductive cycle, because when we over-exercise, our reproductive cycle shuts down and stops. We know that when we drink too much, yes, it's going to be processed through your liver, but your ovaries are not going to escape the pickling process. And I think often these messages don't really get translated, that our overall lifestyle doesn't just affect our diet and our weight, it affects our overall reproductive health also.
Completely. But they wait until you have a problem to say, oh, actually, the reason that you're not getting pregnant is that you're underweight or you're overweight. Have you ever checked your thyroid? You might be either hypothyroid but then it's too late, when you could have changed what I think of. And I love that you use the term ovarian health. This idea that biological age has so much to do with ovarian health and reproductive health. And so egg freezing is a choice. It's an option. And again, it's great that you type that when I saw the title of the talk, it was Planning for the Future Options. And it is an option that is getting more efficient and effective. It is an option for women who think they might need to do IVF in the future. It is an option that should, and I think the three main barriers to this as an option is enough information given in a way that women can make an informed decision about whether it's right for them.
Mm-hmm.
There's a lot of women that egg freezing is right for, and those women should be freezing their eggs younger, not at 38, not at 42.
The average age, the most common age that women freeze their eggs is 39.
Yeah, and that's, and of course, those women know they're likely to go back and need them. So if you look at the data for the women that go back to use their eggs, they're actually the ones that freeze very late. And this is the catch-22 of egg freezing.
Yeah.
I know very few women who froze their eggs, who didn't need them, who regret freezing their eggs. But it's a very personal decision, because I'm sure there are women out there, and I've looked at a lot of survey data, and most women don't regret it, but I'm sure the women are. You know, some people say, think of the opportunity cost. If you spend this much on egg freezing, what could you have done? If you'd invested that money, you could have got 3 times or a down payment. But some people don't think about it like that.
It's very difficult to equate the costs, and actually cost is a very important element of it. I think for many, it would be a no-brainer to say, right, let's just do this at a younger age, except that cost is a barrier, and cost is a prohibitive barrier. I always say that there's 2 barriers when it comes to freezing eggs. One is the psychological barrier of saying, it's not really, most treatments, people don't take time to have a treatment unless it's affecting their health, right? Whereas this is a treatment that you're doing in the case of no ill health. You're doing it as a result of, and it's something that takes a lot of time and certainly money and certainly psychological energy. So there's the psychological barrier to that, but there's also a massive financial barrier, and that is most people simply cannot afford to just take an insurance policy out on egg freezing, which is going to cost at least £4,000 or £5,000. There's a question here. Thank you, Sophie, for asking about information about a route to egg freezing. Or is it via NHS even an option? And what about costs? So freezing your eggs via the NHS is not an option unless you have a medical reason, and that is like cancer. And therefore you would need to preserve your fertility prior to chemotherapy, which would actually affect your fertility. What we have tried to create at Fertility is that the other option is that you go to a fertility clinic, they do a workup and they check your fertility. Then they'll do a scan and they will assess what your next steps are. That even those 3 initial appointments at a fertility clinic can cost up to £1,800, and we've combined that in our test for £149. I sound like an ad, but I genuinely felt so strongly about the cost of this, because I too was in that position.
Shouldn't it cost £1,800 just for the workup for step 1?
It just shouldn't. It shouldn't be. It shouldn't cost so much to just simply check what your reproductive hormones are and know what your overall fertility is. And I think, to me, a better investment is monitoring, like Stephanie said, monitoring your fertility over time and saying, okay, now is the time I need to do something. If you know that, for example, for the next few years you are not going to be in a stable relationship, or you're not going to be in a position to do it, then that's another story. And I think then you have to talk about, after you've had your fertility test, going and seeing about getting your eggs frozen. There's a few options I really want to talk about, and that means fertility planning, yes, is monitoring your fertility and knowing where you're at and engaging with your reproductive health, and knowing that your reproductive health is your overall health, and that your overall health actually affects your reproductive health too, and your fertility. And so there's the option of monitoring over time. Then there's the option of pursuing egg freezing, whereby you say, now is the day, and now is always the day, right? Unless you are over a certain age, and there is criteria. Some clinics will not take women over a certain age. I think it's different, but
depends on the clinic. I know clinics that are taking money from women who are 42, and you knowing that the chances that those eggs will get you a successful baby 42 are quite low, as far as genetic, that those eggs lead to genetically viable embryo. but the limit in the UK, at least I know, is sort of early 40s. Okay. The conundrum of egg freezing, and we talk about the main barriers, and the reason why that selection process is important, and having platforms like Fertility that really help to screen these women and then say, okay, actually, if you're really proactive, then you might be a candidate, or you can continue monitoring. Mm-hmm. The conundrum there is, if you pick up someone, we know that, when you look at egg freezing, the younger the better, yet the younger you are, the less money you have. Yep. The older you are, the more money you have, but those eggs aren't necessarily, i.e., you need way more eggs to be able to get a live birth.
Yeah. Ironically, the older you are, the more money you have, the more money you'll spend, because you'll need to do more cycles.
And then some people say, but the younger you are, the more money you spend on storage. But the money for the cycles is way more than how much you spend. I think a friend of mine is spending £200 a month. In the US, it can range from $500 to $1,000. Storage a year.
Okay, yeah, okay, fine. Yeah.
But then you can then say that, are those eggs in that, if someone's storing my eggs for $1,500 a year, I hope it's being stored in the most high-tech, safe, scientifically robust way. If someone's charging me £200 a year to store my eggs, I mean, if they called me in a couple of years and said they got lost, or I tried to use them, like a friend in Zurich who recently tried to use 11 eggs she stored at 39, of which 0 survived thawing, 0. Then, of course, do you see what I mean? So I think the storage is how the eggs are stored, the technology, what the clinic is doing is important as well. So it remains that this conundrum of, well, the younger I freeze my eggs, the better. And again, I still believe that, knowing what I know now, the only time I would have considered freezing my eggs is at 28, 29, 30, knowing the data. But it just so happens that if I had made that assessment and I had the information to make an informed decision, I may have decided, given the cost and given what I assessed my risks are, I may not have done it.
But isn't that a great position to be in? I think from my perspective, at 31, I remember, I think that was my most panic stage. At 31, I remember being, watching lectures, giving lectures on fertility and age-related fertility decline, and what's worse, the age-related increase in abnormal embryos. And I distinctly remember sitting in a seminar and looking at this graph, looking at where I was age-wise on this graph, and thinking, my fertility is in free fall, and counting in my head how many years you have to meet somebody. And I mean, you can't just immediately have a baby with somebody. You have to court them. You have to get to know them. You have to make sure they're not a psycho. Then you have to, enter into the topic of babies. And that, I think, is a really unfair disadvantage that we have, is that all of those decisions seem to be on us. We have to be in the driving seat when it comes to reproduction and reproductive choices, especially around babies and having babies, even though I know just as many men are as broody as women, but we get called the broody card all the time. And I think that there's a huge movement towards women doing it for themselves and doing it on their own. Why rely on another person to, fulfill your dreams? In no other aspect of our lives do we rely on another person to fulfill. We don't rely on another person to fulfill our career goals. We don't rely on other people to fulfill our financial goals. We do it for ourselves. And I definitely think that we need to open, it's a topic in itself for a whole other webinar, but it's something I definitely feel quite strongly about, is, sisters doing it for themselves and going down the route of solo parenthood. I know many mums who've gone down the route. Yes, it's tough, but I think it's actually an awesome one to consider.
And this brings me to, outside of the age factor, we know that your fertility falls with age, and that's why it's better if you think that you might need help in the future, it's better to freeze eggs. If you do freeze eggs, it's better to do it as young as possible. Outside of age, the reason why women might need IVF in the future, and where younger eggs, frozen eggs, will help, is one of the main things is that if you feel that you will need to use a sperm donor and be a single parent, if I had known that I was going to be single at 39, meet someone just before I turned 40, and then have 3 miscarriages of 41, I may have freezed my. So I keep saying it retrospectively, and even if it was an insurance policy, I don't think I would have regretted it instead of that car my father bought me, for being a good student at 28. I think that I would have been very comfortable knowing that I'd had some other route, avenue.
I think it's the confidence that it gives you that you don't have. We can talk about the clinical aspect of egg freezing and the technology and how it's progressed, but there's never any technology that is independent of the psychological and emotional need for it. And I personally see a lot of people that stay in it's the technical term, shitty relationships, because they need that person to have a baby. They don't want to be with that person. They've come to the end of their cycle as it comes to being in a relationship. They've nothing in common. They may have met 10 years ago, and sure, they were friends then, but now they're merely acquaintances, or rather, actually, they're probably closer to enemies in many cases, and yet they stay with each other because they're like, well,
exactly,
I need to have a baby.
And this is I said at the start of this conversation, the 2 people I know who froze their eggs recently were in long-term relationships. So
I know a few people now who have just gotten married and they're still freezing their eggs.
Exactly. So, but they've got you as a friend to remind them to be proactive. But the other reasons that you may not know of that you will need IVF are things like blocked tubes, male factor infertility. I have a friend whose husband got testicular cancer, so they had to store sperm. They had to do IVF. So, if that then happens later in life for you, that you have to retrieve eggs. You've got younger eggs in the freezer. Endometriosis, people with family history of early menopause, people with genetic disorders you want to screen for. LGBTQ community, they are huge. That the access to sort of the choices to have babies is huge, and they use frozen eggs and donor eggs. In fact, I was shocked to find out recently that to donate eggs in the US for families in need, so families with early ovarian failure, people who had medical problems, means they can't have children and their own eggs aren't viable. You have to be between 21 and 30 to be able to donate eggs in the US. Did you know that?
No. I knew that I knew that when I turned, I think when I turned 36, I was no longer, somebody said to me at the clinic, they were like, you're no longer eligible to donate your eggs. And I was like,
if you wanted to donate to a family in need, and of course in the US, you get paid for it. So if you want to pay your college fees and stuff, and there are lots of families out there, gay couples, everyone, and you would need essentially to be under 30 because the data is there. The live birth from those eggs from donor women compared to other women. So for example, we don't have enough data yet for freezers who are 30 or younger, because most of the data we have is from women freezing their eggs at 38, and we see their IVF success rates down there and the ones for donor rates up here. But that's a proxy, because we know that those women are younger, so those eggs are more likely to lead to babies. But one thing I will say is that the things that we can't, I always say, beware of the unknown unknowns. And this is the important thing with monitoring, even if you're not thinking about egg freezing. And egg freezing is, you don't know what you could pick up. And I don't want to worry women, because I know how hard it is in the NHS, and I had to lie to my GP to get testing. But now I look at companies like Fertility who are making that just the basic screening available. And I know how much women spend on makeup and hair and clothes and stuff. And when I look back at all the money, I didn't have a lot of money. I was a junior doctor in the NHS. Go figure how much I was earning. But there's so much that I know that I would have paid for, the odd scan, plus, blood tests, just to know, especially if you had symptoms. But I think the important thing to think about with egg freezing, and this idea that, how do you identify if you are to need help in the future? Recently, a nurse friend of ours who's been trying to have a baby for years, went in to have a scan before stimulation for IVF, and at 36 was diagnosed with ovarian cancer. And, you know, she'd been trying to have a baby, and the immediate thing to have done was to get through her treatment. She had the best doctors, you know, on the NHS, and would have been to go to her frozen eggs and have a surrogate, you know, given the kind of treatment she'd had, knowing that she would hopefully, fingers crossed, survive another 10, 15 years. So it's the unknown unknowns. But sometimes I think this idea of monitoring, if we had the power, if we had the access, if resources weren't a barrier, then we would do the monitoring. We would choose the right women to freeze their eggs as early as possible, because there are unknown unknowns. And doing those kind of tests and screening yearly can pick up things early. It might have picked up a very, very early cancer instead of later stage cancer. Does that make sense?
Somebody actually has asked about if you have no known fertility issues but want to preserve your fertility for the future, is there a reason to get your eggs frozen at the age of 36, or would you wait until you were starting to show issues? Never wait until you're starting to show issues to take action. It's the whole point about proactive fertility checking or health checking, is that you know that you are healthy and you know that you can do something before anything goes wrong. When things start to go wrong, you actually have very few choices left. So the longer you leave it, the less you give yourself in terms of a choice. So I would say no. At the age of 36, if you have no known fertility issues, well, if you know what your reproductive hormones are, then you should probably freeze if you don't have a.
So at the age of 36, if you haven't already frozen your eggs, and that was the age. It's interesting you asked that question, because 36 was the age where I started doing yearly blood tests and screens and scans, and I found a way. I lied to my GP. I found a way to get, because at that age,
now you do not need to lie to your GP. Now you can go through fertility. This is what we've built.
You know, the upsetting thing is that it doesn't work. And I know lots of people that try and go into the GP and make up stories. It doesn't always work. It's getting harder. We all know how stretched the NHS is.
Yeah.
But if you have a private doctor, if you have insurance, even then it's very easy to get a holistic picture, connect the dots, put everything together to give you a personalized picture of what your fertility, where your fertility is and where it could be going. But even at 36, that is the age. And I think if you look at the charts for how fertility drops, at 36, you're either having a baby, trying to have a baby, planning for the future by freezing, or proactively monitoring your fertility. And even if egg freezing early at 30 isn't for a lot of people,
I think it's too late for so many. I think at 30, so many people still assume they're too young to be worried about it. And that at 36, I think the most important thing that you can do for your health is to just check in on your vital signs. And we know now that your periods are a vital sign. And I think for many, actually, they are completely oblivious to their reproductive health and their fertility because they're on contraception. So I think even after a few years, you should definitely give your body a break. Somebody has asked, is 22 too young to freeze my eggs? Would it be better to just continue to monitor my fertility? I would say yes, you should monitor your fertility for another few years, definitely.
I agree. I think that
22, you're going to end up freezing your eggs for another 10 years.
I think that the reason that 22 is too early to freeze your eggs is that when you look at the data, you're measuring opportunity. Why are you freezing your eggs early? Because you want good quality eggs. But when you balance risks and the costs and the actual procedure itself. So I don't know if most people notice the way you actually get the eggs is, a lot of people have had transvaginal ultrasounds, and the ultrasound probe at the end of it has a very fine needle that's attached to the end of the probe was an extraction suction that's attached to some little test tubes. And so when you have a scan, transvaginal scan, And for those of you who've had one, you'll know that they sort of go in the middle, that you look at the womb, and then the lady usually says, and now I'm going to check your ovaries, and they go to either one side with the probe inside, or they go to the other side. And that's how eggs are retrieved. They go to one side, and as they scan and see the ovary, they're pushing against the ovary, they push through and then extract the eggs, and they go straight to an embryologist who looks through, washes it, looks for whether they're viable cells or not to freeze. The egg freezing procedure, the reason why I'd say 22 is too young is that the difference between 22 and 28 in egg quality and amount of eggs you're going to retrieve isn't huge. However, perhaps the maturity to understand all that it entails, the time it takes from your schedule, about 2 weeks, the hormones, and also something else. One of the very rare but important risks of freezing your eggs and having hormones is something called ovarian hyperstimulation syndrome. And it's more common in very young women because, of course, you're more sensitive, so you're more likely to react to the hormones. And for that reason, again, it's a fine balance. It's a waiting, awareness, the right time. For me, the right time is before you have the drop-offs at 30, but not too young where you're freezing your eggs for a very, very, very long time. So the difference between freezing at 22 and 26, for example, is 4 years of storage, but it's perhaps a slightly higher risk of overreacting to the hormones, which can feel a bit crap. I personally know that at 28, I would have been quite equipped to go through the procedure, more than I would have at 22.
I think that also, to caveat that's in the absence of any other underlying conditions, because we've definitely had people who've come to us at 24 who are actually trying to conceive and have just been dismissed outright because they're only 24 according to their doctor. And everybody wants a baby at a different life stage. There would have been a time where having a baby at 22 was totally the norm, and actually I think we should open up the conversation around women actually having babies as opposed to just putting off our fertility. It's strange that it seems strange to think about having a baby at 22 now. And yet before, if you were 24 and you didn't have a baby, it was considered a little bit strange because you would have definitely been married.
22, 23, a lot of my friends' moms, and that was only one generation ago. So no, 22 isn't too young, but it's certainly a good time to start thinking about monitoring, to start thinking about the future, to start thinking about just understanding your fertility before you have problems or symptoms, and getting plugged into a system you trust that can give you information about your health.
Exactly. And I think first and foremost, understanding what your ovarian reserve is at a different stage. If we look at the numbers of people who are infertile, who have lower egg reserve, then actually perhaps for some, as somebody has just kindly shared their story with us, they've said that their AMH is only 6.1 at 30, and imagine it would have been super high at 22, but actually perhaps it would have been within range at 22, and monitoring from 22 would have given you an indication of a severe decline. So I think understanding where somebody's fertility is at from their early 20s and monitoring it over time, because some people witness a drastic drop. One of our core team members has had a fertility hatchling as a result of her declining AMH within a year. She was like, I've got a few more years. And then she saw it drop considerably and thought, I'm going to do it now. Yeah. And she's fortunate enough to have been in a relationship to do that. But at the same time, I think these are the things that we should consider when we look at how many people end up needing help, that actually for some, perhaps at 22, maybe it would have been the right time for them, but understanding where they were at maybe at 22 and 23 is also critical.
And it could have been the time, having an AMH 6.1 at 30, the time that decision, that very personal decision to freeze eggs would have been made at 28, for example, that drop off only happened at 28 or 26, but certainly monitoring from 22 is such, there's no harm.
No, definitely not. I think much more people should be doing it. Exactly. Much more people, looking at the numbers, far more people should be doing it. And then I want to answer one of the other questions. Are there any other options apart from egg freezing to preserve your fertility?
To preserve your fertility, the other options are embryo freezing. If you're with someone who knows that they want to have a baby but aren't ready, and you think that you're together, you could freeze embryos, which actually has a higher live birth rate. It seems a bit drastic, and I think that the schools of thought are very, very different. Everyone has their own opinion around why would you go through that procedure and freeze embryos? Why don't you just have a baby if you're with that person? But
honestly,
again,
I think we need a whole other session
exactly.
Let's have another session on egg freezing versus embryo freezing, because people ask me this all the time. And again, I think the success rates are definitely ones we need to pick apart, because not all of them are very honest when it comes to some of the clinical data. I may be assuming incorrectly, but I think in terms of you mean a non-medical intervention to preserve fertility, there are really, apart from lifestyle and diet related interventions, I think diet is probably, and our lifestyle are probably the most important indicators for preserving fertility. There are known associated risks with drinking, including drinking at different times of your cycle, and the effect of drinking and of course smoking on your fertility, and certainly
stress, autoimmune disease, any chronic illness that you think that can affect fertility, and that's why I think general health checks are good, because you pick things up.
Yeah.
If you have thyroid problems, for example, but proactively, outside of holistically looking after yourself, the only evidence-based way of truly preserving fertility in order to have a live birth later, and it's by no means perfect, but it's the best option we have, is egg freezing, and looking after yourself.
And looking after yourself. Well, in the interest of looking after ourselves, it's now 9 o'clock. Exactly. Stephanie, it's been an honor to have you and to just chat. I think we could probably talk all night, but we'll definitely have you back. There's been a load of messages across the Instagram saying how amazing you are, and how many more questions how many more sessions we should have with you. So let's line it up.
Get dial-ins as well. We'll do a session that's just a Q&A, questions around health, and get the audience to sort of to come in.
Definitely. Thank you everyone for joining us tonight. There's quite a number of you, so I really appreciate you joining so late in the evening. The recording will be sent out to anyone who missed it. And thank you, Stephanie. It's been a pleasure.
What fun. Take
care everyone.
Bye.
Bye.